Hi, I'm Vanessa. Did you know electrotherapy can be used to alter cell structure and increase substance permeability? I will discuss clinical considerations for treatments including workplace health and safety. Finally, I'll present a case study providing an overview of treatment concepts, and while developing a treatment plan, I will identify conditions and concerns, recommend electrical treatments, and identify the physiological changes and aesthetic benefits. By understanding the biological, electrical, and chemical reactions involved with various types of energy, we can identify the most effective modalities to address skin conditions, improve cellular health, and the appearance of skin conditions. In order for substances to permeate through the stratum corneum, disruption of the hydrolipid barrier must first occur. Conditions must be optimized to transport substances across the cell membrane, and healthy functioning of key organelles must also occur. Hazards and risks can be managed with adequate training and education. High standards of general workplace health and safety, ethical and safe practices including infection control and cleaning is also critical. Clinical procedures should always support manufacturers' instructions and recommendations. Electrical safety protocols include regular servicing, and prior to use, testing tags and cords should be inspected. With the device turned down and off at the wall, confirm secure connections between the device and other parts, and protection from sources of water. Cords and devices should not form trip hazards, and electrodes should be tested before use on clients. In galvanic desincrustation, the anode is attached to the client, and the cathode moves on the treatment area over a coupling medium. In 1989, Simon suggested an alkaline gel would increase conduction more effectively than sodium-based scaling solutions. Sodium ions are attracted to the cathode. They gain an electron and react with the hydrogen and fatty acids on the skin's barrier. Once it becomes sodium hydroxide, it mixes with more oxygen and an alkaline reaction occurs. Saponification results. Ultimately, the hydrolipid barrier breaks down, contributing to increased permeability through the stratum corneum. When the current is reversed in iontophoresis, the anode attracts chlorine ions, and they lose an electron. It then reacts with hydrogen to produce hydrochloric acid. As the skin is likely more alkaline following desincrustation, hydrochloric acid balances the pH, restoring the skin's barrier while acting as an astringent to contract dilated pores. Ionic ingredients that address specific skin conditions are infused in a water-soluble conductive gel. Then, the ions are repelled away from the anode towards the cells. As ionic concentrations increase, the electrochemical gradient creates an action potential, resulting in the transport of nutrients into the cell, increasing cellular oxygen and hydration. This helps to combat free radicals with antioxidants delivered transdermally. Ultrasonic exfoliation occurs after applying an aqueous solution and applying a low-frequency ultrasonic transducer. Microvibrations excite the water molecules while loosening and weakening bonds between dead keratinocytes. Sebum and keratin is loosened, resulting in desquamation of 20 to 50% within the stratum corneum, according to the Healthy for Life Center, and this results in the softening of the hydrolipid barrier. In sonophoresis, a conductive gel increases the conduction by decreasing air between the transducer and the skin. Acoustic energy produced by sound waves is directed towards the body. The negative pressure results in the formation of gaseous cavitation channels. In a study by Joffermans and others, they proposed this to be primarily consisting of hydrogen peroxide and calcium ions. These channels, along with pressure from the wave, allow active ingredients and serums to be forced into the skin. Thermal energy is produced, providing other therapeutic benefits such as protein and collagen synthesis. In direct high frequency, the current flows through a gaseous chamber producing light energy and exciting electrons in the air gap between the electrode and the skin. When the high frequency light energy reacts with oxygen, ozone is emitted. This has an antibacterial and drying effect on the skin, particularly useful for oily and acne skin. The contraindications and precautions for galvanic facials have been listed. Before performing treatments, a good understanding of these will ensure treatments proceed safely. Kate is 24 years old. She has oily skin with type 1 acne. Comedones, papules and pustules and enlarged pores are present. Hyperpigmentation as a result of excessive sun exposure, dehydration and excessive oil flow was identified during skin analysis. Acne and potential scarring, in addition to mild signs of premature aging, are her primary concerns. improving cell metabolism, increasing oxygen, promoting cell turnover, and reversing free radical damage will improve cellular health while creating an environment free of microbes and bacteria and reducing oil flow. No contraindications were identified. Pre- and post-treatment care was explained, and precautions were discussed in addition to the expectations and sensations of various electrical treatments. There were no specific risks associated with performing electrical treatments on Kate, and all available modalities are potentially suitable. After a classic facial followed by galvanic desincrustation of 5 to 7 minutes, correction of excessive oil flow is corrected, and signs of acne should start reducing in the coming weeks. Iontophoresis for 2 to 3 minutes after will provide transdermal delivery of serums to address the reoccurrence of acne, erythema, inflammation, and prevent further development of premature aging signs. Direct high frequency will further impede acne development, and future treatments of ultrasonic and sonophoresis with direct high frequency is planned. At the cellular level, electrotherapy has the potential to alter cell structure and increase membrane permeability. This enables estheticians to target conditions at deeper levels of the skin and exponentially increases the effects of topical formations, improving aesthetic outcomes and expediting anticipated results.